What's the lag on that, Jim?
Oh, I think Lewis will be in his secret lair working on it this morning. We should have it up this afternoon.
Very, very cool. You mentioned before the break these Cadillac health plans that your lovely administrative assistant is the recipient of, which in fact you said
it's more of a Chevy
really
than a Cadillac.
Okay, yeah, a nice Chevy.
It's a nice Chevy.
What defines how can you tell if you got a Cadillac health plan or a Chevy health plan or a Yugo?
Okay, so here's the deal. If your health insurance costs more than $9,000 a year, it's considered a luxury plan.
So $9,000 is going to be the arbitrary cutoff, the ceiling.
And the only exception to that is if you're a union employee. Union employees are exempt.
Oh, really?
Oh, absolutely, because that was part of the negotiation he had so they can get votes next time from union employees.
Hey, Stephen, you want to unionize?
Yes, go.
Okay, we're going to form a union.
Yeah.
Absolutely, go union. Power to the people. But, the thing we were talking about is my administrative assistant. All of us know our age affects what our health insurance costs. And, she's not elderly. She's not a high school student. She's 58 years old. She's a normal person who's working hard every day. And because of her age, her health insurance costs just over that limit. It costs $800 a month. And me as an employer, I believe that all my employees should be taken care of as far as health insurance goes. So I don't need the president to tell me to do it. We provide health insurance for all our employees.
Okay.
No problem. But because her plan, which is based on her age, costs more than $90,000 a year, guess what? She's going to get hit with a 40% excise tax on the cost of her plan.
Even though she's not paying the cost herself.
Well, she gets to pay the tax for it.
There's something fundamentally wrong about that.
Well, but welcome to the new world of Obama. And Pelosi, right?
Yeah.
Let's not blame the president. Let's blame Pelosi.
All right, well, now, let me ask you this then. Is there a reasonable tax strategy for mitigating that effect? Is there a workaround on something like this?
Well, if I wanted to take advantage of the new Obama scheme of the world, what I would do is I'd just say, okay, forget it. Instead of me spending $10,000 a year to accomplish this social objective of providing health insurance to my employees, I'll just opt out. I just won't buy health insurance for anybody. And, they can all starve in the street, and all I have to do is pay $750 a year as a penalty to the IRS for not providing the plan, but I save $9,200 a year.
It's actually cheaper for you to do that.
It's cheaper for me to do that.
To break the law.
Well, not to break the law. It's just part of the law that if you don't want to provide the health insurance, you got to pay a $750 penalty. It'd be cheaper for me to do that. But how does that accomplish the objective of encouraging people to provide health insurance for their employees when I get penalized for doing it, when the employee gets penalized for doing it? It's stupid.
Well, now, on the other end of this equation, how much leverage are you going to have with your provider, with your health insurance provider, to negotiate those rates down to something just below the Cadillac line of scrimmage?
That's a good one. How about no leverage?
Really?
Oh, absolutely. We had a talk with our agent. I went to lunch with my insurance agent like 3 weeks ago. We had this very discussion because, every year the rates do go up, and it is a pain to have increased rates. But as a small business owner, we have less than 10 employees. I have no leverage.
And, I'd be curious to see how many businesses or employees of businesses fell under that category after the recent increases we've heard about, where insurance companies have been raising their rates 30% or more.
Well, exactly. So I don't think it's going to be just Kathy over at my office. I think it's going to be people in offices all over Houston, all over the United States, that because of the premium increases and because of the age and the fact that a lot of us baby boomers are getting a little bit older, that a lot of people are going to fall into what they call a luxury health insurance plan when they're just normal people with normal coverage. I mean, I don't get them to send a limo for me, when I go get a checkup. I don't view it as luxury, okay? Now, I love my primary care physician, and by the way, he's a client of taxcpahouston.com. I mean, he knows we do good work, but he doesn't go send a limo to pick me up. So, there's not, the free masseuse. There's none of that, no pedicure while you wait for your appointment. None of that stuff. I don't view it as luxury. I get to wait in the lobby for 45 minutes just like everybody else. So I don't know how they come up with these arbitrary numbers.
Unbelievable. Just unbelievable.
713-965-650. If you've got an opinion on this, we'd love to hear from you. 713-965-650.
What about joining other like-sized companies and you create a bit more of a bargaining leverage with these guys? Will that work?
Well, that's one of the things that they are saying that this new plan is going to be. Basically, it's going to be the Stalinist view of the world, where we all dress alike, we all look alike, and we all have one-size health insurance that fits everybody. But if we all have one-size health insurance that fits everybody, why am I paying $10,000 a year per employee for it, and the other people get to pay nothing for it? I mean, you know, it kind of undercuts the whole idea of American fairness. I don't tell everybody else what to drive, what kind of car they should drive. Nobody tells me what kind of car I should drive. If I want to drive a junker, I pay less. If I want to pay more, I can drive a fancier or newer car. But if I got to pay for the luxury car, I darn sure want to have the luxury plan. I don't want to get the junker if I'm paying for the luxury car.
And if I want to save money on brakes, I buy a Toyota.
There you go. It doesn't have any.
Yeah, had to go there, didn't you? Yeah, just had to go there.
In their defense, I've been driving a Toyota product for the last 20 years. I've never had a problem with my brakes.
You know what? I agree with you.
It's not a plug for their company, but I got to tell you, I've never had a problem.
That's right.
No, and I think most people haven't.
If I do manage to get pulled over by the state police, I'll say that's what it was. You know, I'm sure they're hitting that a lot now.
I was just about to call you, officer. I can't stop the car.
Right.
Oh, man. 713-9-650-650 is our number here in the studio. Jim Tripon with Tax CPA Houston is actually in the hot seat answering these questions. And I'm sure that we've touched on some things that you're going to want to know about. You're going to have some questions about Jim a little bit later on.
Well, what they're really going to want is they're going to want the special tax report on how not to have Nancy Pelosi pick your pocket and take all your money away in the next 4 years.
Absolutely. And you go to the website, specialtaxreport.com, which is kind of amazing. What tax report? Doesn't matter. It's the special tax report.
It is a special tax report.
Specialtaxreport.com, or you call the office at 713-661-1040.